listening to the Pharmacy Podcast Network.
Nitric oxide is a molecule that's produced naturally by our body, and it's important for many aspects of good health. Its most important function is vasodilation, meaning it relaxes the inner muscles of the blood vessels, causing them to widen and increase circulation. Nitric oxide production is essential for overall health because it allows blood, nutrients, and oxygen to travel to every part of your body effectively and efficiently. This podcast episode is sponsored by Berkeley Life. The company is based on a simple premise: provide a plant-based equivalent supplement regimen to support nitric oxide levels for a healthy cardiovascular system. Learn more by visiting berkeleylife.com.
Today we are joined by Dr. Richard Natale, who is the president of the Carolina Urology Partners, and Greg McKettrick, a company pharmacist, director of business development and marketing with Stanley Pharma Group. So we're here to discuss some of the success that Dr. Natale has seen by implementing the Stanley Pharma protocols in treating some of the ED patients in his clinic. And part of that protocol obviously being nitric oxide supplementation and diagnostic test strips. So Dr. Natale, if you wouldn't mind kind of giving just a bit of background to yourself, your professional background, and your involvement in the Carolina Urology Partners, so we can get a bit of context kind of from where you're coming from.
You got it. Well, first of all, thanks for having me tonight. The Carolina Urology Partners is a practice of about 24 urologists and 13 extenders. We have about 12 to 13 offices throughout the Charlotte area, as well as the Columbia, South Carolina market. I work out of Concord in Mint Hill. My background is in men's sexual health and erectile restoration. So I do treatment of ED from medicines all the way up to surgical implants. I've been doing so for the last decade in this market. In terms of the role in my practice, there are more sexual health oriented physicians in my practice than just myself. In different areas of our city, so we cover the gamut of all access to those folks. I'm the president of the practice, so I do have the benefit of being able to have some of an administrative take to it, as well as my clinical activities and all the rest. I think that's the kind of the shakedown of me in general. I mean, we can always drill down to more specifics, but that's my background.
Okay. And without myself having much of an understanding of the type of training you go through as part of becoming a urologist, how much of that training was focused around, as well as sexual function and treatment of sexual function in men and women as they age? Yeah,
it is the majority of urology programs, like where I attended University of Florida for my 5-year training, the majority of programs will have at least a introductory kind of rudimentary exposure into sexual health and really just erectile function restoration. A lot of what you do outside of the training is the things we do now, once we get into practice and once you've honed your skill sets at. Now, I was fortunate that in my training, I had more than one physician who had expertise in the area of treating advanced treatments erectile dysfunction. So I had exposure early on in my training and developed that over the course of a couple of years. But really, the next decade of my career is where I very much honed in on my skill set and kind of refined my practice.
Okay. And I think I've asked Greg this question before, but since you started in this space, or started in your urology clinic or practice, have you noticed it become a more common issue where male sexual function comes up, or maybe just that people are more willing to talk about it, or how has that changed over time?
I will use a related condition as an example. So Peyronie's disease, which is the curvature of the penis. When I first got into practice, I probably spoke to patients once every few months about it. I see it multiple times a day now. And I think there's two reasons for it. I think there is the first isn't actually because it's more prevalent. I think it's been there. No one wanted to talk about it because it's disease state awareness, right? People knowing I have a problem and, there's some answers for me. And then B, the cultural shift, right? I think there was a time where sexuality, sex, all those things were not spoken of. And if you had a problem, you just kind of suffered in silence. So I think those are the two reasons I see a lot more of this.
Okay. And as you obviously you started to implement the Stanley Pharma protocol, and what were you doing before that? And like, what was different about your treatment protocol that, you know, and what was the success like of that treatment protocol? And, you know, how much did it change when you met Greg and started to implement that?
You know, it's interesting because going back and doing an inventory of what my practice was before I met Greg, to be quite frank with you, the value of a compounding pharmacist in the past to me was some of the other folks that I'd used in the past was just, you mix me up injections. That's all I need. And when I stumbled onto Greg as an alternative, and I don't remember exactly where it was, but we started talking, and as time went on, I said, you know, it's not just about mixing these drugs. And I was able to really then start saying, hey, Greg, I ask him questions, we talk. And it really started to build upon that, my better understanding of how to treat my ED patients. And it just kind of all happened very naturally. It happened all at the same time. I would tell you that, you know, several years back in my normal kind of practice pattern was, I think the building blocks were there. I wanted to find out what patients are doing to get better, what the meds did. You know, I wouldn't just give them the prescription and say, call me if it works, or if it doesn't work. I would try to follow up on them and really get engaged in that. And once I started doing that, it was also around the time I'm working with Greg.
Yeah.
And as we build that, you're like, wow, we're really transitioning this now into a kind of a full-fledged package for patients. Hey, listen, you get a physician who can give you everything you need, who's going to guide you from whatever therapy, and who has a partner that you can buy into that says, hey, man, maybe this guy isn't a great surgical candidate, and maybe we need to optimize the shots or whatever the circumstances. So that's it. It was really something that kind of was a fortunate development. It happened at the right time, and it happened concurrently. Me building my own kind of my skill sets and all the rest, and then meeting Greg and going from there.
And I might focus on that, Greg, with you a little bit, because I know that's something that you work with pharmacies on in terms of prospecting their locality and finding, you know, urologists that they can work with. So out of interest, do you remember kind of how that initial connection was made, and, you know, what the kind of next steps for you were after you can identified a shared way of working together?
So the background of it is, when I really started with ED, we got very deep into the education, injection training, and consultations, and kind of took it to an extent where, just from a time conservation point, we had to make things more efficient. So we started to use a lot more training videos and materials that were very easily accessible to the patients and to the clinics. And as we fine-tuned those, that built, I think, our patient base, and certainly I think our footprint with the urology clinics, just because it was such a nice reference for them to be able to send a patient, and, you know, literally from soup to nuts, we were able to kind of get them all the information they needed in the training. What stemmed out of that were things like the relationship that I have with Dr. Natale and Carolina Urology Partners, in that, you know, I was able to really start picking up more information on their patients, and at the same time, because, you know, we're very easy to access. Patients can come in and ask questions and sit down and go over what their situations, what's worked and what has not worked for them, and then we're able to adapt therapy. And the great thing is, you know, Dr. Natale and I have the relationship where I can basically say, hey, I spoke to your patient, Bob Jones, and, you know, this is what his current therapy is. This is the response he's been seeing, and then give him some suggestions based off of that, whether it be implementing new therapies or just changing the therapy. And at the same time, you know, as I'm following these patients, a lot of them will work with extensively over a long period of time, and in some instances, our therapies aren't adequate. So, I'd like to say that we are very successful, and in most patients we get the very positive results, but there are patients who, whether it be incontinence that we just can't get under control, or climacturia, or they are just not responsive, or they don't like the therapy for the penile injections. These are patients where I'm going to turn back to Dr. Natale and say, hey, this is a surgical candidate for you, whether it be for the incontinence or for a penile implant. So the relationship really built very organically, in that we both have obviously our areas of specialty, but they overlap so much that we really can benefit the patients and then benefit each other's practices by offering better services overall.
And so I understand it in terms of how it works on a day-to-day basis. Dr. Natale, if a patient presents to you with issues around sexual function, is your first protocol to refer them to Greg and his team, and then if Greg deems appropriate in some point in the future, refers them back if they need more, additional elements of care? Is that kind of how the general workflow goes?
It really depends. It's very circumstantial, right? So I will see one of three types of patients. I'll see the early delving into therapy, right, where we're just exploring things. We're going to talk about, intro meds. We're going to get you on low dose sildenafil or whatever the circumstance is. You're going to get the next type of patient's going to be, hey, I've already been there and done that. What else is there? And those are the ones that are key for getting to Greg, right? Because they've already said, I took my Viagra, I've been on it a couple of years, and I'm seeing things change. And that's the person who needs to have that deeper discussion, not outside of what I will do. And then the third person is the folks who are so refractory, and they're so kind of what we imagine being an end stage, that at this point now we are having a strict conversation about surgical treatment. So those are the three groups I see. I wouldn't want Greg doing the intro stuff, because I think what our relationship is the perfect kind of physician-pharmacist relationship, right? I look at disease, I judge severity, I understand therapeutic options, and then I say to my colleague, hey, listen, this is what we need to get done. And my colleague says, all right, what is your assessment? Great, here's where I'm going to take off from there. So that's why that middle group is so key for getting to Greg, because those are the guys now that we're talking about combination therapy, supplements and all the rest. And those are the folks I'll funnel to them for sure.
Okay. And we talked about it before we started recording here, but you had mentioned how sometimes in surgery, given that it's a nitric oxide discussion at the end of the day, you've seen, or it's visible to you, that blood flow plays an issue in the issues these men are experiencing. Can you talk a little bit more about that, and kind of how that you can visualize that as part of a surgical procedure?
It's interesting. I always use this analogy with my patients, and it's worked very well for me. I tell them, I say, imagine you have a nice plump sponge on the top of your sink, and it's moist and it's plump and full. You can take that sponge, put it under the sink in the dark place, it dries up and shrivels up. And that's such a fitting analogy, because you get these guys who maybe they're so long in the paradigm of their ED, and they really didn't get intervention when they should have, or whatever else. And you get to this tissue, this fibrotic, dried corporal tissue, where you get in there and you'll make incisions into the penis and it will not bleed at all. There's nothing that happens, right? And it's impressive, because you realize that this chronic lack of blood flow has resulted in this condition. And those are the guys, for example, when you talk about therapeutics working well or not, I don't know that there's any way pharmaceutically to be able to get them to where they need, because they don't get anything down there, right? So I've seen that real time, and you can compare that to other conditions. Whenever we do implants, for example, in guys who have nervous, system issues, right? You can tell the difference in the blood supply, because their blood supply is fine. It's just their nerves don't work. It is impressive. So it is a demonstrable difference between the guys who have that decent blood flow over the years versus the ones that haven't. And
for a patient, I know, Greg, that you recommend NO or nitric oxide for really almost all patients. And is there a particular protocol you use for patients, say, that are going to surgery? Is there a certain period before and after you recommend it? Or, how do you layer that into kind of a patient protocol if they're going back to Dr. Natale for additional treatments?
So there's different types of surgery, and a big part of what I do, I work with patients with prostate cancer who are going through, whether it be robotic or open prostatectomy or radiation treatment. Those are patients where we're using what I term penile rehabilitation, where I incorporate medications like the PDE5, Cialis, and Viagra, along with the nitric oxide to really boost the performance of those medications. In addition to that, we do physical therapy, we use mechanical therapy using a vacuum pump, and then incorporate other medications. So a lot of those patients are the folks that I see on a regular basis. Very often, and unfortunately, part of the reason I started working and developing the protocol was because I would have patients show up for consultations, sometimes 10 years after prostatectomies. And unfortunately, there's not always the same attention to the aftercare. I think a lot of times it's the patient. A lot of times they try a therapy and it doesn't work, and they give up, or they don't understand that there are options available to them. So at that point, we are really looking to reestablish blood flow to address a lot of these issues that at that point have been longstanding for years. And we get good success. We see the outcomes, we see the benefit, but the patients where I'm referring back to Dr. Natale, a lot of times, like he had mentioned, they're kind of what we would consider the end stage of the disease, where either they don't like the therapies or the therapies just are no longer effective for a variety of reasons. So those are more the surgical in terms of the implant, or recovery patients at that point. So it really is, there's different types of surgery that we're looking at here. And some of what I do deals more with the kind of the patients where they had good function, they had prostate surgery, which impaired the function, and then we're looking to restore the tissue, the blood flow, and their erectile function at that point.
Okay. And I think you both touched on that kind of back and forth that you have with patients, and you've gotten to know which patients are best treated by which one of you. Is there any hesitancy from a patient perspective? Say they go to you, Dr. Natale, for treatment, and then you send them over to a compounding pharmacist, or vice versa. Is that something the patients are comfortable with, or is there ever any hesitancy to say, I want to be treated by a urologist on this topic, or vice versa?
Well, what's interesting to that point is it's really how you're presenting it to the patient, right? So where, and not to pick on our colleagues out in other kind of, more retail pharmacies, but I tell them to say a lot of time the retail pharmacists are there, they're just there because they gotta be. And yes, while they can offer you counseling, that's their job. I said, I don't feel that there's the same benefit. I don't, for example, send someone to a CVS to ask about using, NO supplements with Cialis. I just don't think that person would be well versed in that area, because they're also counseling the next person over about their whatever, medications they're on. So I don't know that there's that value. And I think that's really huge. And then, obviously the discussion I have with them, not only just the general of this is who I use, but then I specifically say, these are guys that, we work together because I trust them, because what they've done, because their specialty interest, so on and so forth. So I really can say that without any hesitation that I have not had any patients that have really pushed back on me. Obviously there's the times when someone says, insurance coverage and all the rest, but really that is probably the only time I might hear something, but otherwise they're on it. Yeah.
And previous to this, a partnership with Greg, were you recommending a nitric oxide supplement of any type, or were you aware of its possibilities, I should say? No.
No, honestly, not really. I mean, the most I would probably counsel a patient on occasionally would be like L-arginine, L-citrulline type, circumstances. But to be quite frank with you, the concept of supplementation was not one I really considered, because, you're thinking, it's almost like if you're a mechanic, you'd like to believe that you're going to check the engine for gas first to make sure that's the reason why it's not running, right? But we don't do that necessarily. Yeah. We look, oh, your engine's not running, I got to start doing something else, right? We got to start repairing it. So not understanding that in the beginning, or certainly not considering it, no, I wouldn't talk to them about it, but I do now.
And out of interest, has it kind of have you become more open to other supplements potentially, or is it
absolutely
something you have? Yeah, nice. Absolutely.
And this is outside of the scope of the conversation per se, but I've, looking at, for example, conditions like Peyronie's disease, I think there is a world that could be explored from a pharmaceutical or combined pharmaceutical surgical standpoint to help benefit these patients that we don't know, right? I mean, certainly, again, using a disease state, getting patients on PDEs early on in Peyronie's disease is really important, right? So these are things that we're seeing. I think there's a lot more to explore, and I would be open to whatever supplements to help my patients.
Nice. Greg, Dr. Natale touched on it there. Obviously, the combination of nitric oxide and PD5s is something that I think both you and I have been really promoting as complementary rather than being anyway competitive. And we talked before the call the recent publications or recent studies on PD5 inhibitor use and potential long-term benefits on cognitive health. Do you want to touch on that a little bit, or kind of give some background as to your thoughts on that?
Yeah, and again, when you think of PDE5, you think of medicines like Cialis and Viagra. Of course, everyone has seen the television commercials. Hey, it's all about getting an erection. But the basis of this really goes back to the early studies where, the discovery of Viagra came along because they were looking for medications to treat pulmonary hypertension. They knew if they could boost nitric oxide levels, the function of the heart, the function of the pulmonary capillaries, everything was going to improve by dilating those blood flows and increasing the blood flow. In the same respect, in other conditions, whether it be a cognitive deficit like an Alzheimer's, which is a very progressive condition, if you can maintain healthy blood flow, maintain cognitive function throughout the aging process, you're going to benefit the patient overall. And, it's not just that. The treatment of, of course, right now, what are we looking at? COVID. Well, the treatment of COVID with nitric oxide, of using PDE5s incorporated and adding nitric oxide in active COVID treatment is something that is very much in practice right now. So there's a number of different benefits, and as you reflected, recent studies with Alzheimer's has really brought it to light.
And I suppose for you, Greg, you obviously are very dialed in on ED treatment. I know you do other things in your pharmacy, but you've obviously found a real need in supporting urologists and other clinical specialties in their ED treatment protocols or care. Is there other ways you think compounding pharmacists can be more hands-on, or other areas of care that maybe aren't as something you're as focused on, but you think that compounding pharmacies could get more involved in a way that you've done with urologists?
So, good question, because to be perfectly honest, when I initiated my therapies, when I really started working with this, our pharmacy, the urology component was really probably about 20% of our business. The other portions were working with bioidentical hormones, with pediatric medications, with other types of sterile injections, ophthalmic medications, respiratory medications, a lot of veterinary medications, specialized topical compounds for different types of pains and neuropathies. So, we treat a wide spectrum of patients in different conditions. It's just so happened, and whether it's my fault or by favor, our urology business has gone from 20% to over 50% in the last few years. And I think, again, it's because of the relationships that we have with doctors like Dr. Natale and Carolina Urology Partners. It's just really become a big focus. We do a lot of work with bioidentical hormones. It's just once we started to really see the patient gains and the outcomes, urology just was a natural go-to for us.
Mm-hmm. And have you found, I suppose, in your area now that there's kind of a word of mouth element to how your business within urologists grows, just with, people seeing good results from your protocols and sharing that within their networks?
I think there certainly is a component of that, and you have, new physicians who come into the area, or they will meet someone like Dr. Natale, a colleague at a conference or continuing education, something to that effect. I think we've also had a lot of gains come in through some of the things like the podcast networks, where they will see the information or hear it and start making some phone calls. They'll start inquiring as to it. So, because of that, we're using our protocol in, probably right now about 20 different states with urology practices and different pharmacies. And, we're doing patient management and the same assessments that I do with Dr. Natale's patients now. We're doing it more on a national level.
And just on a high level, like your new urology clinic approaches you, what is your process to kind of onboard them so that they can have that referral back and forth?
Sure. So the initial meetings, a lot of times they're in person, and I'll actually go into the urology clinics to present the protocol. And Dr. Natale might be able to kind of echo off of this, but I think that my approach in a lot of these cases is a little unique because I really develop very intimate relationships with the patients, where I get into conversations and consultations that go beyond, as he mentioned, what your typical pharmacy consultation might be, to where I'm going through their whole background and everything that they've tried in the past, any surgeries or other comorbidities that are really adding up to cause them their main issues. So when I go in, it can sometimes be in a live meeting. I do a lot of Zoom meetings with urology clinics and introduce this to them. And to a point you made, there's a lot of times when a urologist will kind of look at me and go, what the heck? Where are you coming from? Because, nobody else is offering me this. So there is a little bit of a learning curve there where they have to understand that, we do really have the capacity to help.
Yeah.
And I suppose that one last question for you, Dr. Natale, is, within your clinic, you said you had 33 clinicians. Are they all kind of similarly engaged with Stanley Pharma, or are you kind of the point person, or how has that relationship evolved the group?
I would love for all 33 of them to be. They're all obviously free to associate with whom they feel more comfortable. I can tell you that the overwhelming majority, however, because of the relationship that we've had and what Greg has grown over the last several years, I think are switching their focus to Stanley because they see the product, right? In the end of the day, we can look at it in two ways. There's the business relationship, but there's the patient, just basic treatment and caring for these folks. And when you have both components working well, right, you have someone who we can work and partner together well just from a, marketing or business standpoint. And then you have, oh, hey, by the way, these guys actually care and they're good at what they do. And they provide a product that's superior to many, many other people. That's a piece of cake. So I think it starts to then generate its own interest from all the other practitioners. So I'm pretty sure the majority of the folks are using Stanley.
So the question was, as I asked Greg earlier, have you recommended his protocol to other urologists? And I guess what I'm trying to get at is for pharmacists that are looking to build their business, there kind of is a snowball effect when they have a good level of care with one urologist. There's generally tight circles within any kind of clinical specialty.
Sure. What I do what has transpired, and just again, kind of almost naturally, is that Greg and I have spoken about their protocols, and he's asked before, like, hey, would you mind speaking with these folks or endorsing me here and all the rest? Like, of course, and I do so without any qualms whatsoever because of what I believe in. I do that. The interaction with my partners is the big stuff because those are the people I'm in every day seeing and getting them kind of involved in this. Outside of that, the circles that unfortunately, with all the COVID stuff, the circles that we like to run in together as a group, we can't run in right now because we can't physically be together. But yes, in a general sense, yes, outside of my practice, I've put my time into kind of promoting Greg and Stanley's kind of work. So, and
last thing, Greg, for us as pharmacists listening or radiologists hopefully listening to this, is there any how would they get in touch with you in order to kind of learn more about how you work together?
Well, obviously we have a presence online. They can pull us up, whether through Stanley Specialty Pharmacy, which is stanleyrx.com, or on the clinical side for consultative work, the Stanley Pharma Group. Certainly they can reach out. My personal email, I have Greg at stanleyrx.com, and I have Greg at stanleypharmagroup.com. As far as looking to work with us, I open my toolbox up to whether it be pharmacists or urologists so that they can see exactly what it is. When I developed the protocol, I did not invent anything. I am using methods and medications that have been used for decades. I think it's just the way you incorporate it and put it into a nice comprehensive package, and the element of patient care. Not to pat myself or Dr. Natale on the back, but I think that there's a difference when practitioners actually look to practice the art of medicine. Yes. As opposed to just connecting dots and following what's in maybe a textbook. When you treat the patient individually, when you incorporate other professionals where they can benefit. I reached out to Dr. Natale last week. I had a referral that came in on a very complicated patient, and having him as a resource to be able to say, here's the situation, here's what's going on, this is my thought, tell me what you think. When we can do that across state lines, when we can do that and start bringing other professionals like ourselves, if I can get other compounding pharmacies to start following these practices and making the connections with the urologist, that was my whole goal, is to improve patient outcome. There's a huge need. And I wish I could put Dr. Natale up on a billboard across the country, because what we do together and how we work, if patients understood the resources that are available, there's so many men and women that really don't understand all of the services and everything that can be done to help them.
And based on even just our own anecdotal experience working in nitric oxide, I suppose the level of gratefulness of patients when you're able to effectively address sexual function concerns or sexual function issues is astronomical. They appreciate it like nothing other. So I think the combinations that you found are obviously proving very beneficial. Anything that I guess either you want to share additionally, or anything else that you feel is kind of important to share about, either the way you work together or the protocol as a whole?
I would like to say I feel as though we have the ideal clinical relationship. I touched on this earlier, that offers a patient now that comprehensive package, right? We know that people try to get there. We've seen, and this is not slamming anybody. We see these clinics that open up, men's health clinics and all the rest. And I think the reason why they're successful is not because of any other reason, but they try to be collaborative and try to offer solutions. If a physician, a surgeon is able to say to now a colleague like Greg, hey, listen, I want to give patients everything they need. And whether it's, whether they're going to be a candidate for surgery or a candidate for shots or candidate for oral meds or supplements. I want to be able to offer them the comprehensive care under this because they deserve it. And this is how we're going to really be able to say to them, yes, as Greg said earlier, soups and nuts. We can do it all, whatever's there. So having that relationship is so key because now in my practice, there are men who I may have marched along the pathway of surgery quicker than I would have now, kind of thing. Because Greg and I work together and we find solutions. So I think it's a key and ideal relationship. And if you can replicate that in other markets, that would be fantastic. It's great for the people, great for patients.
Yeah. And again, I think from my understanding of Greg's offerings, it's infinitely replicatable. They have the capacity to help and they have the protocols and the videos and all those components. So it's definitely our hope that it's something that can be shared with any compounding pharmacy and every urology clinic that has an interest in learning more and kind of providing that complete level of patient care that he has put together. So fantastic. Okay, great. Well, look, I really appreciate your time this evening, and I'll share this around with everyone once it's completed, and hopefully we can get the word out there and start to see more people taking on a program like this.
Absolutely, man. That's the hope. That's the aspiration.
Absolutely.